This is Deanna Epstein, and this is my medical family therapy project presentation. So, answering the first prompt of medical family therapy and its evolution in the healthcare field. Um, Medical family therapy was created to intersect the needs of patients, the healthcare system, and the family system. It was developed in the late 70s with the creation of the BPS model by George Engel. The field then grew from there through the 80s and 90s and ultimately established the first doctoral program for medical family therapy in 2005 at East Carolina University. Medical family therapy is about the concepts of health, loss, trauma, and death in the context of family and in relation to the different systems that the family interacts with. It is a holistic approach to healthcare that values a whole person perspective. So that means looking at every patient as a whole person and not just in relation to whatever illness or diagnosis that they have. Medical family therapy is highly collaborative, and medical family therapists work from a systemic perspective. This allows them to understand how relationships help help us better understand health and illness. Medical family therapy operates from the biopsychosocial spiritual framework. This framework believes that well-being has 4 different dimensions. So MedFTs apply this perspective in their work with patients by asking questions about the patient's biological, psychological, social, and spiritual lives in order to better understand and serve them. And it's important to note also that spirituality in the BPSS framework isn't necessarily about religion. It's really more about how patients make meaning in their lives. And medical family therapy focuses on cultural humility. It puts emphasis on having an awareness of our own biases and social locations as medical family therapists. And there are many roles that MedFTs can hold in the healthcare field. These can range from working in clinical settings, leadership and supervisory roles, and also in research. The next prompt was discuss the 4-world view. So medical family therapy operates by balancing the 4 healthcare worlds of clinical, operational, financial, and training. Clinical refers to what's happening in the healthcare system, what providers are doing, the interventions that are being done. Operational refers to policies and workflow of the system. Financial refers to billing and the finances. And training refers to training for various roles in the system. Medical family therapy works to promote collaboration between these 4 aspects of the healthcare system. So that's really the main emphasis of the 4-world view is how do these 4 systems collaborate with one another, because it's believed that when they are collaborative, that's when a healthcare system is operating at its best. This in turn leads to a system that's based on the concept of integrated care, which is strongly founded on collaboration, coordination, and teamwork between providers and between these 4 worlds. The next prompt, identify the appropriate medical family therapy screening protocol. So there are many different assessments and instruments that can be used by a medical family therapist for screening various mental health disorders. Just a few examples are are the GAD for anxiety, the MCHAT for autism, PHQ for depression, geriatric depression scale, or the GDS for depression in the elderly, the Vanderbilt ADHD diagnostic tool for ADHD, and the audit assessment tool for alcohol disorders. So as you can see, there's a wide range of tools, and they all operate differently. So it's important for the medical family therapist to have an understanding of how to conduct the assessment that's going to be most relevant to the patient given their symptoms. So the next prompt was to identify what happens when a positive screen happens. So if a positive screen happens for any of the assessments that could be done, firstly, it's important for the medical family therapist to communicate with the primary care provider this information. They should then collaborate on next steps because collaboration is a big part of medical family therapy. When the medical family therapist does meet with the patient next individually, that's when it would be important to address the patient's stage of change and determine what stage they were in. So some questions that they could ask based on the specific stage of change are as follows. So for the pre-contemplation stage, a question can be, what are your initial thoughts and feelings about your diagnosis and or medical condition? The contemplation stage, a question can be, what benefits do you see in making change? For the planning stage, a question can be, what methods of change do you plan to take? For the action stage, in what ways do you feel different after making change? And the maintenance to termination phase, what coping mechanisms have you identified that can help you maintain these changes? So it's really important at this point, if a positive screen happens, to ask questions in order to identify the stage of change that the patient is in. Next prompt, identify the behavioral health interventions that could be used. How would you adapt them to different social factors? There are many different behavioral health interventions that could be used for a patient who has a positive screen for a mental health disorder. Some include individual therapy, family therapy, group therapy, inpatient or outpatient care, and hospitalization. It varies case by case what intervention is most appropriate for the patient. Adapting them to different social location factors can first be done by the medical family therapist, really being culturally sensitive to the social location of the patient, as well as being aware of their own bias and their own social location. Applying the BPSS model and that whole person approach that's really central to medical family therapy can also help to make sure that the patient's interventions are adapted to fit them individually. Compare the treatment plan for an individual versus a family. So this is an individual treatment plan and a family treatment plan are going to be different. An individual treatment plan is customized for the patient only. It can be based on the patient's agency, strengths, resources, and their coping skills. Individual therapy may also be a really important facet of a patient's own individual treatment plan. So, of course, an individual treatment plan is really going to vary depending on what illness and diagnosis the patient has. and that's up to the family therapist to then, medical family therapist to then create an individualized treatment plan that's most appropriate for them. A family treatment plan looks at the family as a whole and focuses more on the interactions between family members and not solely on the patients themselves. So a family treatment plan almost views the family as the patient, if that makes sense, because you're really, the medical family therapist is treating the case from a systemic perspective. And it differs from a treatment plan, and for a family is going to differ from an individual because there will be different goals. Usually goals for a family treatment plan are focused on improving family functioning, drawing on the family's strengths and resources, um, and providing psychoeducation for how the family can support the system. And those were all the prompts. These are my references from our 2 textbooks. Thank you.